Hi, we are into the fifth session of our discussion on medical research fundamentals, and today the discussion will be about descriptive study designs. A little briefing of what we have learned in the earlier discussions. On the whole, epidemiologic studies can be divided broadly as descriptive and analytical studies, and descriptive studies can further be divided into individual and population based studies. In individual based studies, we have case reports, case series, and cross sectional studies, and in population based, we have ecological studies. In analytical study designs, we have observational and interventional study designs, observationals including case control and cohort studies, and interventional including the clinical trials. The descriptive studies, as we saw, it includes the case reports, case series, cross-sectional and ecological study designs, and we will be looking upon one after the other. First of all, it is case reports. Case reports are nothing but a detailed presentation of a single case. This may be a new or unfamiliar or rare disease, and this will generate a hypothesis regarding the pathophysiological mechanism which is identified newly, and this will make the other colleagues aware of such a finding and to be familiar with such findings in their further practice. For example, adenocarcinoma arising from gastric duplication cyst, which is a new finding with invasion to the stomach, is a case report which has been published recently. This is an example of it. And case series are nothing but, as the name suggests, it is a series of cases, that is a larger group of population, that is example around 10 to 20 cases with a particular disease. This will allow to assess the play of chances, because if you take a single case, you will not know what is the difference between the other fellow patients, and so this will allow to study about the play of chance in the findings and the manifestations, and this is a way of delineating the clinical picture of a disease. And one disadvantage is that there is no comparison group, and so we will not know what is the real manifestation of the disease. For example, pneumocystis pneumonia, which is common in AIDS. We can take 10 AIDS patients and study what is the different manifestations in these 10 patients and then compile them up to form the clinical manifestation of that disease. Then we have ecological studies. As we know, the unit of analysis is the population, that is group, and the disadvantage of this is that there is no individual level of info on distribution of the expression and of the exposure and the disease, and so this will help to relate whether the population and what kind of population and what is the increase in rate of disease also have uses on increased frequency of the suspected exposure. For example, whether the fat intake in population of Tamil Nadu related to the increased incidence of CVD in that state. So this also helps to only generate a hypothesis, and this will form the base of the further studies. And now we come to the cross-sectional study designs. That is a study at a single point of time, and the unit of observation and analysis is an individual, and this is also called as prevalence study. And in this study, the recruitment of the study participants will be from the population or a sample of the population, and the and it helps for observation of presence of more than one or more than or equal to one outcomes and more than or equal to one exposures. So it comes under both case control and cohort study designs, which we will see later. And example of such a cross-sectional study is a good example is census. And uses of cross-sectional studies are, as we know earlier, that it is used to find out the prevalence of a disease or their risk factor estimation, and it also helps in the distribution of health, helps to study the distribution of health problem by time, place, and person, and hence it helps us to plan a health care service delivery, and it also sets priority of disease control at large scale, example at a country level or a state level, and it helps to generate a hypothesis. However, it is not ideal to evaluate a hypothesis. As we saw earlier, that for evaluation or testing of a hypothesis, analytical study designs are required, and it also helps to examine the evolving trends of diseases. For example, before or after surveys, like for example, whether a new drug is good response of a disease, example malaria, and that can be studied after sorting a disease. and it can also be able to evaluate the burden of a disease and risk factor. For example, whether in a village or any particular disease is prevalent, or any age group is particularly prevalent for a disease, can be studied using a cross-sectional study. And among all the histories or risk factors which we are studying in a cross-sectional study, we can see whether risk factor is more common for a disease can be found. So this is called as analytical cross-sectional studies. That is, among the risk factor studied, we can find out which risk factor is more common for a disease. For example, whether the prevalence of a physical inactivity and childhood obesity are associated, and whether another example is what is the level of satisfaction of treatment in GH among the patients. These are all the examples of cross-sectional study designs, and during the study, if we find a single risk factor which is more common, then that is called as analytical cross-sectional studies. And some advantages and disadvantages of this cross-sectional studies are that advantages that is it is a fairly quick study because it evaluates at a single point of time, and it is quite easier to perform than other studies and less expensive. And some disadvantages are that is not useful to study the disease etiology and not suitable for study of rare diseases. And since we are including prevalent cases, that is new and old, like new cases, some population may not be aware of the disease. So we are including both the new and old cases. That is a disadvantage. And we are measuring both exposure and outcome at the same time, and so we will not be able to find out which had occurred first and which had followed the exposure. So that is a difficulty which is faced in this cross-sectional studies. And a summary of what we have learned in this descriptive study design is that case and case report and case series are for uncommon clinical manifestations which we are publishing to make our fellow colleagues be aware of such findings. And ecological studies are that which can relate a group level data to a population and then generate a hypothesis. And cross-sectional surveys are that which help us to measure the burden and magnitude of a health condition in a population. So that's all with this discussion, and our next discussion will be on analytical study designs, which is the most commonly used study designs in our medical literature. And stay tuned for our next discussion.